Good evening, everybody. Can you hear me? Great. We are going to get started, I think, since it's 6:30, despite the weather. We're going to get going. So I want to just say thank you for being here tonight. Thank you for braving this weather. My name is Leslie Wagoner. I live in Stoddard, and I'm currently the president of the League of Women Voters of the La Crosse area. On behalf of League and tonight's co-sponsors, AARP of Wisconsin, Aptiv, and AAUW La Crosse, we want to thank you for your interest in tonight's program, and we especially want to thank our panelists and our special guests for accepting our invitation to speak. For those of you unfamiliar with the League of Women Voters, we are a nonpartisan political organization that encourages the informed and active participation of citizens in government. We also work to increase understanding of major public policy issues and influence public policy through education and advocacy. The League takes positions on key public policy issues after study, debate, and consensus by our membership. In Wisconsin, League's actions on healthcare have been consistently tied to our positions in support of an efficient system that provides affordable, accessible, quality care for all residents of the state. So I think you can see our, I guess they were up there. Our policy statements were up there. And in keeping with those positions, League has been monitoring congressional budget actions affecting Medicaid and the looming impact proposed changes would have on recipients, providers, and all of us in the community. Medicaid funding is an essential part of Wisconsin's public health system, as well as a significant component of the state economy. So, where are we at in this moment in time? We know the House Budget Blueprint instructed the Energy and Commerce Committee to propose changes in spending programs that would lower outlays by $880 billion over the next 10 years. We know the Congressional Budget Office estimates the House Reconciliation Bill, which was passed on May 22nd, would reduce federal Medicaid spending by $793 billion over 10 years and result in 10.3 million fewer people enrolled in Medicaid in 2034. We know the House proposes to achieve their goal by cutting Medicaid funding, changing eligibility and enrollment rules, and limiting federal dollars to states for Medicaid administration and infrastructure. We also know that last Monday, June 16th, the Senate Finance Committee released proposed reconciliation language that includes substantive changes to the Medicaid and Affordable Care Act provisions in the House-passed version. Based on the Medicaid changes Congress is considering, we know the impact in Wisconsin is going to be broad and substantial. The state's Department of Health Services issued a special report back in April that analyzed various scenarios if federal Medicaid funding were to be restricted. Estimated losses over 10 years are in the billions. And the next slide is a snapshot of who Medicaid covers in Wisconsin. Nearly 1.3 million children and adults in total. And how will these federal actions affect us in the La Crosse area? That's what we're going to hear about tonight. In planning this program, our goal was to provide a forum for sharing factual information in a nonpartisan setting, offer an opportunity for community members to voice their stories and concerns, and highlight ways in which we can act on our concerns. With that comes the disclaimer that information and views expressed this evening are those of our panelists and storytellers and do not necessarily represent the League of Women Voters or our forum co-sponsors. But with all that being said, we are very grateful to them all for participating in this important conversation. So before we get started, I just wanted to give you a quick overview of the format we'll be following tonight. Our panelists will be speaking for approximately 40 minutes. At around 7:15, we'll move into the Community Voices part of our program, which will be moderated by Catherine Kolkmeyer from the League of Women Voters of the La Crosse area. She'll be posing the written questions we receive from the audience, and she'll also be inviting our special guests to share their stories. We are providing paper and pens, and we ask that you write your question as neatly as possible. If your question is intended for a specific panelist, please indicate that as well. Raise your hand when your question card is ready, and we'll collect it for the moderator. Catherine is very skilled at rephrasing questions for clarity or combining questions that are similar. We want to respond to as many questions as possible before our time runs out, but if we don't get to yours, please feel free to remain after the forum for more individual conversations. At around 7:45 p.m., we'll move into the third part of tonight's program, which is advocacy. We want you to leave tonight with actionable ideas for making your views and concerns known to congressional decision makers. And just one final reminder, tonight's program is being live streamed and is also being recorded. Recording links will be posted later on our website, and we'll include that address on our closing slide. So now it's my pleasure to introduce our panel of speakers this evening. We appreciate they accepted our invitation for such a challenging task, educating us on how and where Medicaid dollars work in our area, what they've been following closely in the federal budget deliberations, and the extent of impact if proposed Medicaid changes go into effect. Obviously, a very complicated topic to cover in 5 to 7 minutes, but I guarantee we're all going to be much better informed as a result. So we are going to go in alphabetical order, but before we start, I just want to introduce you, go down the row and introduce you who's here with us tonight. We have Jenny Felty, who is the president and CEO of Aptiv. Then we also have Nathan Franklin, who's the VP for External Affairs and Sustainability at Amplify Health La Crosse. In the middle tonight is John Manke, manager of the La Crosse County Integrated Support and Recovery Services. Carissa Pagel-Smith is manager of the La Crosse County Aging and Disability Resource Center, and Wanda Placheki is at the end, executive director for long-term care and residential services in La Crosse County. So, Jenny is going to start us out tonight. Thank you, Jenny.
Great. Thank you. Thank you, Leslie, and thanks to the League for inviting me here to be a part of this panel. I first wanted to start with some just background information about Aptiv, a little bit about who we are and what we do. So we were founded as Riverfront in La Crosse in 1977. It was a combination of 3 separate organizations that came together as one. Over the years, we've expanded services, both types of services and where services are geographically located. In 2017, because we had changed so much as an organization and we were in different areas, we weren't along the river necessarily, we decided to change our name to Aptiv. And so Aptiv is just a positive blend of 4 words, live, aptitude, active, and adaptive. And so today we serve, upwards of 1,200 people on an annual basis with disabilities. And we currently provide services in 17 counties, but we're also continuing to expand, hopefully, if Medicaid funding continues to support that. So there are kind of 4 main buckets of services that we provide. I'm sorry. Yeah, so that's our geographic area and where our office locations are. So we have 3 main locations, Black River Falls, Janesville, and of course La Crosse, and then we have smaller offices in those other locations. We serve the most number of people in our employment services. So we work with people with disabilities, and this is our largest geographic area that we provide services for employment. And so we support people with all sorts of disabilities to get employment with employers in the community. So could be Quick Trip, could be Amplify, could be, various employers throughout these 17 counties. We help them to acquire the job, get settled on the job, and provide any support that they might need to maintain that work. We also provide youth services starting at age 4 up until age 18 when they would transition into adult services. And this is a combination of skills training services to help youth gain social skills, independent living skills, and also work-related skills. Similarly, for adults, we also provide these skills training services and what we call day services. It's a combination of a variety of things that people can participate in, again, to help them live more independently in various ways. And then we also do provide services to individuals in their homes. This is under the umbrella of supported living services. We provide services to help people live independently in their own homes in the community, typically on their own. This would be intermittent support throughout the week, helping them get groceries, helping them maintain their place, get socially connected in some ways. And then we also operate 2 24/7 residential facilities that we call adult family homes, where we serve 8 men. And these are men who have more complex support needs and can't necessarily live in their own place. So next I want to just talk a little bit about kind of the 3 main areas that Medicaid funding cuts would affect Aptiv. One is the prove your working requirements. The other is the additional eligibility verification that they're proposing people are going to be able to go, or going to have to go through. And then also the state administrative and kind of cost sharing that's being proposed. And I also just wanted to provide some state information, and Leslie obviously provided some of this as well, but from the Department of Health Services, they've released a number of updates about how the proposed budget reductions in the reconciliation bill, and this is just the House bill, this doesn't even address the additional things that the Senate is talking about. They released some information about what the impacts would be to individuals in the state of Wisconsin. And so they are saying that 250 Wisconsinites are at risk of losing their health care coverage, either through Medicaid or through the Affordable Care Act. And of those 250,000 people, 63,000 would likely lose Medicaid coverage. And the overall cost to the state through all of these changes that are being proposed, they estimate to be about $74.2 million. And, I don't have an exact idea of what the direct impact of these reductions are going to be on Aptiv, but given that Medicaid funding represents 70% of our annual revenue, it's safe to assume, and also given the number of people that we support on an annual basis, that they will be among the 63,000 who will lose Medicaid coverage, even though I believe that they're trying to put in protections around people with disabilities. There will be people that we support who lose Medicaid coverage. And obviously that's a huge concern. So how did I do on time? Oh. Yeah, I think I actually skipped the slide about our funding makeup, but you could see, a very large percentage of our budget is Medicaid funding. So.
Thank you very much, Jenny. And our next speaker is going to be Nathan.
Great. Thank you for having this, and thank you for having us. The league was very nice and supplied these little sucking candies for us to clear our throats, and want you to know that I misswallowed it while I was doing this, so I'm going to probably be clearing my throat more than is socially acceptable, so pardon me for that. But I wanted to be here tonight to talk to you a little bit more about tornado warnings. Everybody okay? A lot of the discussion around the Medicaid cuts has been around those who are going to be eligible, or I shouldn't say eligible, who are going to be targeted by job verification, work requirements, things like that. And that is entirely right and should be. But I wanted to bring also a little bit more of a global look at this, while also touching on what we know about that population as well. And talking about what this means for hospitals who provide, the care to those on Medicaid and the conditions we're in right now. The legislation that has come from the Senate would reduce hospital funding, Medicaid providing hospitals, by an additional $5 billion annually. And that's on top of any losses that would be incurred from those who would lose Medicaid. Because there seems to be a misunderstanding that just because people don't have health insurance, they stop getting health care. They obviously keep getting health care, which means it keeps costing the system, which a lot of people say, well, that costs the hospital, but it doesn't cost the hospital, it costs everyone. And one of the other things I want to address is the other misconception that if you're not on Medicaid, this doesn't impact you, which could not be further from the truth. So looking at healthcare at a crossroads, first of all, rightfully so, a lot of discussion in recent decades about healthcare being expensive. Healthcare is expensive. I never pretend that it isn't. We have big buildings, we have a lot of staff, we have expensive staff, we have expensive treatments, extensive equipment. There is no way around that healthcare is expensive. And that is not going to change. As our treatments get more advanced and the care people get helps address their illnesses better, it will not get cheaper. But also there's a misconception about the cost of care. Hospitals are price takers. We are not price makers. Overwhelmingly, what we are paid is decided by those who pay us, which means insurance companies or public payers through Medicaid, Medicare, or those who have other means either to pay or no means to pay at all. And so we have to make those finances work regardless of what those percentages are. Next slide. So to give you some idea of how that plays out, you can see the numbers for yourself, so I'm not going to necessarily read through them. But this is the amount of money we are paid on the dollar for what it costs us to provide the care versus what these payers actually reimburse us. And you can already see that Medicaid only reimburses us for about 45 cents on the dollar, which means if you come in and you get a service that costs $100 for us to provide, it means that Medicaid only reimburses, this is for our system, $45. But you also see that commercial payers pay well over the cost of care. And that is where that misconception of if you don't have Medicaid, cutting Medicaid doesn't impact you. Because whether you're paying for it through your taxes or you're paying for it through your insurance or the lack of wage increase you're getting at your job because your insurance rates are increasing and your employer cannot give you a wage increase or a salary increase, you are paying for health care to Medicaid patients when they're not being reimbursed from these public payers. And the current legislation that's out there will only exacerbate this. The uninsured number is that other number I was talking about, which is just because people don't have health insurance doesn't mean they won't get health care. Our uninsured population, people who still need to come in for care, but are not insured either through Medicaid or through a commercial payer, that is where hospitals lose the most money, which you should read as is where other patients pay more for care because of that lack of reimbursement. So next slide, please. So what does that look like on a global level? Putting that in a context of other businesses. Hospitals are often seen as cash cows, right? Our profit margins currently pretty much across the nation are plus or minus 1%. The vast percentage of hospitals are not for profit. And even pre-pandemic, in the best of years, most hospitals range 3 to 7% margin. And you can compare that. I'm not going to go through this line by line, but if you look at the other two legs of the stool and the modern two other legs of the stool in the modern healthcare system, which is pharmaceuticals and insurance, you can see where the cost drivers are in healthcare. And then you compare that to what an average healthy business is looking to make for a profit margin. Hospitals are well below that. So lots of money coming in, lots of money going out, and that equation to make that work just continues to get harder. What does that mean locally? The Gunderson Health System, as part of Emplify Health, last year lost $340 million serving Medicaid patients, which again, you should read as had to be made up by charging other patients more. And the last two slides that I have summarize a video that we have to show you, which I think Jim is going to play now.
Medicaid, known in Wisconsin as Badger Care, is the government health care program for people living in poverty. It's an important program that ensures Wisconsin families and children have access to care. In Wisconsin, 1.2 million people depend on Medicaid for their health care coverage. While the program is important, it has long underpaid hospitals for the cost of delivering care to Medicaid enrollees, increasing healthcare costs onto everyone else. Let's explain. The cost of employing healthcare providers, including nurses, technicians, and doctors, supplies, pharmaceutical costs, and new life-saving technologies all wrap up into a cost for a hospital to serve a patient. Medicaid's reimbursement rates only pays for a fraction of those costs. In fact, it pays for only 67%, or 2/3. So how can hospitals operate if government only funds a portion of their actual cost of treating patients? Hospitals are forced to shift the remaining costs onto everyone else. This is known as the, quote, hidden healthcare tax. Think of it as an invisible line on a hospital bill. For a family of four, this increases healthcare costs by more than $1,000 a year. When legislators increase Medicaid reimbursement to hospitals, they cut the hidden healthcare tax on Wisconsin families and improve access to care.
One quick note there as I close. You'll see the number in the video is 67. The number I gave you was 45. In the Gunderson region, our Medicaid population is older and sicker. And so our numbers are far below what is the state average, which is usually the number you'll see. Neither is acceptable, neither contributes to the health of hospitals. And if you're familiar with the healthcare situation that happened in the Chippewa Valley, that was a perfect encapsulation of what I've described to you, which is that hospital had way too high of Medicaid and Medicare patients, while those services that were provided by commercial payers were being taken away by private healthcare providers offering services that were higher profit margin. And it literally shut that hospital down.
Thanks very much, Nathan. John, you can turn your microphone on.
All right. John Manke again. Thanks again to the League for having me here. I'm the manager of the La Crosse County Integrated Support and Recovery Services section. We provide a large array of services, and all of those services are either fully funded or partially funded by Medicaid. The individuals that are touched by these services can cover a large variety of demographics and ages and needs. We serve those that have a need for mental health services, those that have a need for addiction and recovery services, and we also serve children with special needs and provide services for them. On the slide that I have up now, you can see the different programs that the Integrated Support and Recovery Services section oversees and provides, as well as the number of individuals that were touched by those services last year. So we're talking about thousands of people, children, all the way up through the adult age group, and a variety of services that help people in a multitude of ways. I think it's important for us to acknowledge the fact that we don't know what a cut would look like for our services. We don't know which programs that we oversee would be impacted and to what degree. Would we be able to provide the services that we do today at all, or in some form or fashion of what we're doing today? And so I think, you know, we're kind of on pins and needles, like many people around the country, kind of waiting to see what the impact is going to be. But what we do know is that the impact will be substantial, and that it will affect people that you know personally and possibly your own family, and it could be a child in your own family, and it could be somebody else. So one thing I did want to do, if we can move to the next slide, is just show some real-world examples of the services that we have provided in our community and the different types of individuals that have been touched by those services, and really drive home the fact that these are the kinds of services that could potentially be removed or not available to people right here in our community that the county helps to support. So, thank you.
Thank you. Carissa.
Yes, good evening, and thank you for braving the weather. I have to be honest, I'm sitting up here thinking, oh my, do we need to move to the kitchen? But we're still here, so that's good. I see Catherine watching the phone, so we're all good. But I do appreciate your dedication to the matter, and appreciate the time to be able to share a little bit more about the ADRC and our potential impact. And again, as others have shared today, we don't necessarily know the full impact, but definitely there are some things that are concerning in regards to the services and supports that the ADRC does provide to our community. But the ADRC, for those that may not know, is the Aging and Disability Resource Center. There is an ADRC in every county of Wisconsin. We provide supports to older adults, adults with disabilities, caregivers, and really anyone seeking help and assistance in the world of aging or living with a disability. So really, we're a resource for many. Oftentimes I say we're the best kept secret, right? People referral, word of mouth, they come and check us out. But we are a one-stop shop, a resource center that offers unbiased support and connections to promote independence and well-being. So our goal is to help people stay within their homes, stay in their community as safely and as long as possible, right? That saves us money to do so. We want to promote independence and keep people within their homes, and that's our job. Our team includes professionals that we call generalists, so they are helping with options counseling and long-term care goals, providing information and assistance. We have disability and elder benefits specialists. We provide caregiver support. We do dementia care. There's a variety of things, right, that we offer at the ADRC. We also manage the county's aging services, so we're providing nutritional supports, again, caregiver supports, transportation, and we also oversee adult protective services. So again, as I mentioned, our goal is to help people maintain their independence and remain in their communities as safely and as long as possible. Do want to make note that while we're located on the first floor of the Health and Human Services building, we're usually out in the community, right? People can call us, they can stop in, no appointments needed, but we love to meet people where they're at. We're often doing home visits and going into the home and having good, real conversations, right? What are your goals? How can we help you maintain those goals and ensure that, again, you're getting the supports that you need? So we are publicly funded, supported by a mix of federal, state, and local dollars, and that helps to ensure that our services are free and accessible. And this Medicaid match that we essentially use to operate our services is essential to daily operations, and I'll talk a little bit more about that in a moment. But just to share a little bit about our impact and how, in general, we would be affected. The last year, we served and supported more than 13,000 La Crosse County residents. Again, people who call, people who come in, receiving a meal, receiving a ride to and from their critical medical appointments or social and recreational opportunities. On average, our professionals support over 600 clients annually, and locally, that's 50% above the state average. So our team do a lot of work here in our local community. We provided 62,910 meals, and that includes 52,000 home-delivered meals, supporting nutrition and wellness for many vulnerable older adults in our community. Also, something I usually like to share is our return on investment. So every dollar that we put into ADRC services, here locally in our community, we save $3.18 in hospital costs, right? So that's a strong return on investment. Our work helps people stay in their homes longer and more safely, improving the quality of life and saving, again, like I said, the community money. Next slide, please. So what's at risk? Like I said, there's still a lot of unknowns, but certainly what we're aware of at this point is that there is a potential loss of 50% of our ADRC operations. So 50% of our dollars come through Medicaid through a match. So based on the work that we do, we're able to receive Medicaid match dollars, and that's 50% of our current operations. In addition, 40% of our aging operations, so when I talk about meals, caregiver support, approximately 40% right now is currently federally funded, so we're at risk of losing 40% of those operations. That also includes elimination of very key critical programs, supportive services, helping people, again, stay in their homes. We often are helping fund various assistive devices, ramps, getting to and from, in and out of your home, other sorts of devices, again, to help you maintain and live independently. A lot of flexibility in some of that funding, but that's at risk of being eliminated. Health promotion, preventative services are key, right? How do we help stay healthy and in our homes? That's at risk of elimination, as well as very vital caregiver support. Many of us are caring for loved ones. There's a growth in acknowledgement and recognition of caregivers, which is fantastic, but we are at risk of losing those dollars to support our local caregivers. With the 40% reduction in aging operations, approximately locally here, we would have a reduction of about 20% fewer home-delivered meals and about 40% fewer congregate meals, right? So we offer a meal service where people could come and dine, and again, it's not always just about the meal. It's about socializing and coming together. And as well as those home-delivered meals, while we don't guarantee a welfare check, it often is, right? We're often the only individuals that our participants see in a day, right? So we come and we offer not only the meal, but checking in and making sure everyone's doing okay. So obviously all of that has potential to have major impact to the individuals that we serve, but also the community. Clearly fewer resources, right? Less people to answer the phone, help people navigate the systems, reduced access to very critical, important services that help, again, like I said, maintain independence, and increase strain on all of us, right? Family caregivers, the systems. It has great risk of a lot of strain for many people and systems. Obviously, in our community, higher costs, right? If people can't stay in our homes, they have to go somewhere else, right? So that's costly. The costly services, right, for folks to be able to fulfill their needs. But potentially weakened partnerships, inability to collaborate, everyone will be stretched thin, and also slowed innovation, right? I take pride in La Crosse County that we do a lot of great, neat things. We might not be able to get that opportunity or have that chance, right, if we're all just doing what we can to get by, right? And just know that there's so many people that might need assistance and unable to do it and have to, again, do what we can, certainly, with less, right? It would be very challenging and would slow a lot of the great work that we've done up to this point. That's all I have to say right now, so thank you very much.
Thanks very much, Carissa. And our final panelist for this evening is Wanda Placheki.
Well, again, thank you for the invitation to talk a little bit about the potential impacts of Medicaid on the long-term care industry and the people that we serve. So I think about the La Crosse County system, which is actually 2 campuses, one in West Salem, one in La Crosse, part of a county system of nursing homes that is a tradition, I would say, a rich tradition in the state of Wisconsin. But currently, even though at one time all counties operated at least one nursing home, currently 36 counties have nursing homes, and 5 of those this year have decided to either exit the business entirely or look at a management company or a private industry to manage those. And that is basically because of the people that we serve, the complexity of needs, and the high reliance on Medicaid that most county facilities have. So in thinking about Lakeview and Hillview campuses in specifically, we currently have over 75% of our total revenue stream is reliant on medical assistance. So out of a $24+ million budget, we currently have approximately $16 million of that is either Medicaid, traditional Medicaid, or family care funding. When you think about that, in the past, we have tried to make up for inadequate Medicaid funding by, again, passing on those additional costs to our private pay residents. We could not pass on the amount of money that we would need actually to operate our services for the few people that we actually have that are either self-pay or Medicare. But we have, over the past several years, the state of Wisconsin has invested in nursing home Medicaid funding. And so I think currently we've been feeling fairly confident that we will be able to cover at least 90% of those costs that we have to care for individuals with the funding streams that we currently have. That is really at risk. Even though the Senate has stated that they are leaving long-term care alone, it really is a misnomer, I think, to think about what that might mean for our communities. So when I thought about sort of why we would still be at risk when there has been a very stated goal that long-term care will be sort of left out of the cuts, that is not necessarily true. We're still at risk for a variety of reasons, and one of those is that there will be a smaller pool of Medicaid funding in the state of Wisconsin. So anytime there's a smaller pool of funding, there's going to be more competition for that funding. So the state of Wisconsin might have a stated goal to cover 90 to 100% of our direct care costs in our Medicaid funding. That's not going to be able to be sustained if there's a smaller pool of Medicaid. So we know that, again, if we're talking $16 to $17 million that is dependent and reliant on Medicaid funding, even a 10% cut in that is going to be very hard to make up in our Medicare or private pay funding. So one of the things that I will say is that we also know that over the past several years, lots of providers, not-for-profit providers, for-profit providers, and government facilities have addressed the lack of funding for medical assistance in a variety of ways. And one of the most significant to our community has been the reduction in the number of nursing home beds available for individuals in La Crosse County. And what that means for, I would say, the hospital systems is that people sit for longer periods of time, way past the time when they might need those acute care services, thereby maybe securing a bed that all of us might need at some point. So lack of availability even in that acute care setting because of our inability to accept admissions because we have downsized our facility. So for example, I would say the Lakeview campus at one time was over 200 beds. They currently are at 102 licensed beds, and that's across all settings: nursing home, behavioral health, crisis stabilization, and assisted living. The Hillview campus, in just thinking about their more recent downsizing and right sizing, is, they've gone from over a 200-bed nursing home. At the end of our renovation project, we will be a 26-bed skilled facility. So again, thinking about that is not unique to government facilities. That really has been happening industry-wide. So if you're thinking about how it will impact perhaps you, perhaps other people that it could be lack of an available bed. I think the other thing that it means is one of our other strategies for addressing lack of funding is really related to staffing. So government facilities are very well known for staffing at a higher ratio than most other types of facilities, by payer type. And CMS does rate all nursing homes in their Nursing Home Compare website, and both campuses for La Crosse County have a 5-star, which is the highest star rating that you can get in their staffing, which means we have higher than both the state average, the county average, and the federal average in terms of the amount of staff that we have related to our direct care staff, so CNAs and nurses. That changes then as funding goes down, that we start to look at how can we get by with fewer staff, how can we make things work differently. So that is also another risk, I think, is again that quality of care. The quality of service is directly tied to the number of staff that you have that are able to take care of the residents. So that is an area that we again keep looking at, keep trying to assess. I'm always looking at, again, that right sizing and what's the right number of staff. I think the other thing that concerns us is that one of the items in this budget is a retroactive eligibility window cut. So looking at the time you start to apply for medical assistance to the time that you complete that application process. Currently, it provides for a 90-day window to get that done, so that it will, medical assistance actually will look back or go back 90 days and provide that MA coverage. They're talking about for individuals in long-term care nursing home environments, reducing that to 60. That is really challenging because the vast majority of the time, it takes almost that full 90 days for families to assist that parent, that elderly parent who maybe has not shared information with their children, maybe doesn't even understand all of the pieces of their assets, in homes and insurance policies and income, all of those things. So it typically does take close to that 90 days. If we won't get funding that goes back more than 60 days, we could be looking at, for residents that come in as self-pay and then move to a medical assistance or a need for medical assistance, we could be looking at 30 to 45 days of maybe not getting paid at all, which again, I think about that in terms of what that means for our overall budgets and our need to be sustainable, financially sustainable. I think in terms of the things that we have, our strategic, I would say, preparation areas, again, we continue to look at revenue diversification, so looking at other ways that we can bring in revenue, other services we might provide that maybe would be less reliant on medical assistance. We also are looking at, of course, operational efficiencies, and we continue to do that. We've done that. That's really been our lifelong, Jane laughs at that because she knows it's our lifelong mission to try to do that. And then, of course, to embrace innovation and workforce investment, and then advocacy does matter. So we encourage everybody to make sure that you are continuing to share your stories.
That is a very nice segue into our next section of the program. First of all, I just want to thank all of you for sharing what is definitely a sobering preview of what can be expected if these Medicare changes go into effect. It's hard enough to see the numbers and realize the scope of what's at stake for all of us. But we also know that beyond the sheer metrics, there is the immeasurable impact Medicaid has on individual lives, on our families, our friends, and our neighbors. So we wanted to highlight some of those voices tonight, as well as address some of the specific questions you may have. So I will turn things over at this point to our moderator, Catherine Kolkmeyer, who will get us started.
Thank you, Leslie. Thanks, everybody, for being here, and thank you to our panelists. Again, we will have several questions, hopefully from the audience and also from our planning team, and we'll be hearing from some of the members of our community who have come to join us. No, you can't hear me? Is this better? How's that? Awesome, thank you. Thanks for letting me know. So we did have one question. If there are other questions, still can't hear me. How's that? Okay. Thanks, everyone. There are still opportunities to ask questions. If you received cards up front, we do have others available if you'd like to ask a question of any of our panelists or all of our panelists. I do have one question from the audience so far, so we'll start with that. And the question is, at what risk are government employees for losing support and or coverage for their own health issues? I wonder if any of our panelists can address that question from the audience. I can repeat the question. The question is about what risk government employees might be at for losing support or for coverage in the event of Medicaid cuts to their own coverage. Are there any insights from the panel on that? Thank you.
I think, Catherine, as I mentioned earlier, one of the risks and one of the things that our staff worry about is if our funding is cut by a significant amount, what does that mean for their jobs? Right? So we have no intention of cutting jobs because of this. This is not our plan, but there is that fear. And because of that, then sometimes that means people are looking to exit the industry, to exit our facility, even prior to that, because there is that fear. So I think it's more about their fear overall of being able to work in the environment that they want to work in.
Great, thank you, Wanda. Okay. We have another question, and this is specifically for Nathan about one of the questions, or one of the slides that you had about Medicare being 75% of the coverage. The question is, what about supplemental plans, like the court supplements, like the Elite plan, and does that still apply? How does that relate to Medicaid cuts?
Well, I can't speak to that one specifically.
Okay.
First, I need to qualify one of the things I said was the Medicaid losses to the Gunderson system at $340 million. That's actually our combined losses between Medicare and Medicaid. But I'm not sure, like, to a specific health insurance plan, how that would fall in.
Great, thank you.
Sorry to whoever asked that question. I can't help you out.
That's quite all right. Let's hear from some of our community members who have come to help tell their stories. I know that Kathy has come and has offered. That's a phone, okay. Kathy, would you like to come and share your story about your experience with Medicaid? Thank you for coming.
My name is Kathy.
Yeah, get close.
Okay, can you hear me now? No.
We'll get you all set up here.
Okay, my name is Kathy, and I live here in La Crosse. Tonight I'm going to speak about the stress and Medicaid, and it's something I feel every day. Our 47-year-old daughter has had a complicated and fascinating life. She hemorrhaged at birth. She had a shunt put in when she was 4 months old. And for you that don't know what a shunt is, it's a drainage system like your plumbing, and it takes the fluid off the brain and puts it somewhere else in the body. Without the fluid being drained off the brain, she would either die or have significant brain damage. Within the first year, 40% or more of shunts fail. It's a system that has a lot of problems with getting it to work. So healthcare has been a critical part of her life. If everyone had healthcare, I wouldn't be here tonight, and that's what I prefer. Everyone should have healthcare. But here I am. Okay, I'm hearing about all the fraud and waste in the government, from the government. Well, then the government lawmakers need to deal with the fraud and the waste. They should not be taking away critical care and services for people that need them. I get really angry about comments on people are cheating the system, they're lazy, they don't deserve it, or they should be working. This is especially true when Senator Johnson says it. He said people must earn Medicaid. They should not expect the government to provide health care. He also says recipients must work 20 hours a week. Of course, that only applies to able-bodied people. So who's going to identify who is an able-bodied person? I'm sorry, but I don't have faith in our president or legislators doing what's best for disabled people. In fact, my faith in them is running close to zero. To me, it appears that representatives and people who want to get rid of Medicaid don't know who uses it. Daily, we are hammered with statements concerning how much fraud and waste is in the Medicaid system. Where does this come from? Give us the data. Getting rid of fraud and waste may sound great to the base, but this is rhetoric of beating people down and stressing people out. It feels like people on Medicaid are being blamed for needing health care or not being able to work. This is dehumanizing and needs to stop. I'm sorry, I'm not used to talking about Sarah. She deserves her privacy. And decisions need to be made. You cannot keep this up. Sarah's medical history, briefly: 75 surgeries, 2 strokes, Botox injections, baclofen pump injections, and there's many other medical issues. People that say they are talking about medical issues don't have the right to say people are cheating the system. Sarah is not cheating the system. If she doesn't work, will she lose Medicaid? Sarah has had 2 jobs, both less than 10 hours, both with people supporting her. Unfortunately, the type of jobs she has have been outsourced. She can't get those jobs anymore. We've worked with Riverfront and DVR to try to find her a job. It hasn't worked. So the new paperwork requirement, let me tell you a little about paperwork. I think every year we fill out like 6 forms a year. Some of them require research and a lot of work. And for Mike Johnson to say, well, it's not asking too much, it's just a little enforcement of this policy. She couldn't fill out the paperwork, so she'd lose Medicaid. A lot of people can't figure out the paperwork. Some of our legislator wants to make the application process so rigid or require so many reports that recipients will end up giving up. They won't complete the reports in a timely fashion. How many more people will need to be hired to deal with all the paperwork they're creating? They are creating a ton of paperwork. I can't express how frustrated I am that people in our country and our legislatures are saying, what's in it for me? I'm not here for the people anymore. As parents, what do we do if she loses Medicaid? Excuse me. Our daughter is very aware that Medicaid may be taken away. One day she was talking about health care, and her question to me was, what's going to happen to me? What would you say if it were your child? Sorry about the motions.
Thank you, Kathy. Your voice is very important, so we appreciate you being here and sharing your story about your family. One of the questions that we have from our planning team for the panel is that Wisconsin is one of only 10 states where lawmakers have not expanded Medicaid under the Affordable Care Act. What have you seen as benefits or drawbacks of expansion in other states and programs similar to yours? Would any of the panelists like to answer?
Sure. I can say from the Integrated Support and Recovery Services side that there are states that have the ability to fully fund addiction and rehabilitation centers, to fully fund local recovery service teams, and to provide a drug and rehabilitation services locally at a level that I don't feel that we can right now, and that it would be great to have that additional funding to support. So not only on the addiction and recovery side, but also mental health. We are oftentimes sending people quite far to receive services, sometimes not even within the state, and that is directly correlated to our ability to pay for it. When we don't have the funding through Medicaid to pay for some of the services that are available in other places, we have to draw locally from our own county funding, which requires us to be very aware and scrutinize the decisions and where we are sending people of all ages. So I think that's one area that I've seen personally and that we deal with on our team.
Great, thank you. Any of the panelists like to speak to that? Let's hear about one of our local programs and how they might be affected. Jason Larson is here as the Executive Director of the St. Clair Health Mission and wanted to share his perspective on what Medicaid cuts might mean there. Thanks, Jason.
Let's grab it. I'll just lean. I'll just stretch here a little bit. So hi, everyone. I'm Jason Larson, Executive Director of St. Clair Health Mission. And yeah, to answer that question, I know we had a press conference even just probably a year or two ago where we could close if Wisconsin expanded Medicare coverage. So a lot of people think of we're a completely and totally free clinic, pharmacy, we have a thriving mobile medical program, and community health workers embedded in both health institutions in our community. We could close with just that expansion because we don't serve the poorest of the poor, because as we're learning tonight, if we didn't realize, they get Badger Care, they get, the Medicaid or Medicaid, whichever word. We serve the people that are in the margins or that are uninsurable. So we serve that 200 to 300-ish% that doesn't qualify for Badger Care, still can't afford health care, and if they could afford maybe not the best health care plan, they certainly can't afford the, medications, were to look this way. And so for us, what we're seeing, so as a free clinic, completely funded by community dollars, grants and individuals, we're seeing our major systems, even thinking of the grant dollars that have been pulled nationally from research, well, 10% of that is also admin. So that's going also into staff and other pieces. So it's kind of like, I forget that movie about the emotions, but you're seeing all the pieces go offline. Healthcare is going to struggle at the large scale. Scenic Bluffs is concerned at the large scale. So as all these things shrink away, what we're really working to do is work with everyone right now. We have kind of a 6-month to a year plan to really work with our major partners. 99% of our medical clinic is run by volunteers, to really ramp up volunteerism again, because we see that we may indeed go back to St. Clair Health Mission of 15, 20 years ago when we had, it's 60, 40, 50, 60 people a night. In our numbers over the past 5 years, clinic alone have gone up 193% after COVID waned. And the other kind of side we see as a huge population that we serve is Latino, undocumented, working full-time, who in our state can't buy into health insurance, or any state, even if they can afford it. So we kind of have that double-edged sword right now, trying to serve a growing community that we need in our region of workers, while also seeing that a huge population might lose insurance that will largely fall to us, kind of the last house on the block. So working on building better clinic infrastructure, which is in the works, but we won't say a lot about that today. And starting to talk to our major partners that really a huge volunteer push doesn't just help us, it helps both the major systems, it helps Scenic Bluffs, so that when and if this does happen, and I think it's going to happen, we're all a little bit better prepared to kind of absorb the blow together and keep people healthy.
Great.
Yeah.
Thank you,
Thank you.
Jason. Another question from our planning team. I don't know how much any of our panelists are involved in this, and Jason, you might even be part of this, but the question is, would federal Medicaid funding changes affect the Pathways Home Plan to address homelessness in La Crosse? Are any of you involved in that?
Yeah, so my team does oversee the specialized unit for Pathways Home. They go out in the community and work with individuals who are unhoused and are in need of services, and help connect them with the services that we have available to the county. At this point, I'm not aware of any impact to the Pathways Home program or to our own specialized unit. But of course, it's all part of a bigger umbrella, and there are ancillary impacts that we could expect to see across a multitude of programs. So I'm not aware of anything, but there's always a potential that it could have an impact, yeah.
Great, thank you. Nathan, did you want to address that?
Yeah, in a kind of roundabout way, we're obviously very involved in that development of that program. But to give you an idea, I mean, the connection there is that what we're trying to do in a lot of these capacities is get upstream from these problems, right? Whether it's people who are unhoused or healthcare. People on Medicaid are 5 times more likely to get the care they need when they need it. And they're 4 times more likely to get the preventative care where we get in front of the issues that cause long-term, really expensive healthcare. You know, that's something that our system has worked diligently on over the years, is to try to help our patients stay out of the hospital, help them be healthier, so that we can focus on the patients who need the most care. As I mentioned earlier, you know, after our merger with Bellin Health, Emplify Health is now the largest healthcare system in the state of Wisconsin by geography. So that means we serve close to half of the counties in this state, and that's a lot of rural space. I know a lot of you are from this area and know La Crosse and our main hospital, but we have 10 other hospitals across the state. We have 120 other clinics, and the care that we provide is designed to keep people in their communities and healthy and working. And that leads, I'll circle back to a question that was asked earlier about the bigger picture being people are worried about what's going to happen to jobs. Healthcare providers are often the cornerstone employer in most communities. And about half of rural hospitals operated at a loss in each of the last 10 years. And about 10 close every year across the country. And like I mentioned earlier, we experienced that here in Wisconsin not too long ago with our neighbors to the north. That's, even at a smaller hospital, that's dozens of jobs Those tend to be higher paying jobs, jobs with benefits, jobs where people buy cars and buy houses, shop downtown, eat out at restaurants. We too often, as I mentioned in my open remarks, we think about this, we compartmentalize, right? Like, this is a Medicaid issue. I'm not on Medicaid. It's not my problem. But this expands out through our community. Even if you're just a hardcore, like, buttoned up business person and you just care about the numbers, this will hurt local economies, right? As hospitals struggle and are able to hire less people, and it makes it less likely that people go into healthcare careers, which will just exacerbate the workforce issue for our industry, which I think most people are probably familiar with, that addresses across industries.
Thank you very much. Oh, we have another question. Thank you. I'd like to invite Amy to come up and speak. Amy is not just sharing a personal story about Medicaid, but also about one of our local programs in keeping with some of our most recent comments. Thank you, Amy, for being here.
Okay, we're good. So hi and good evening, everyone. I'm Amy Dummer. Thank you to the League of Women Voters, the AAUW, AARP, and Aptiv for hosting the event and allowing me the space to give my testimonial. I currently reside here in La Crosse. In 1995, I was a graduate of Holman High School. In 2000, I earned my Bachelor of Science from Milwaukee School of Engineering. I served in the U.S. Peace Corps from 2012 to 2014, and in 2023, I earned my master's from Viterbo. This is my ACA and Medicaid story. In the summer of 2016, my dad was diagnosed with a terminal brain tumor. I turned my whole life around, moving back from Thailand, into my childhood bedroom to help my mom with caregiving. My parents were both on insurance through the Marketplace, also known as the Affordable Care Act or the ACA, also known as Obamacare. Then in the spring of 2017, shortly after my dad went into hospice care, my mom was diagnosed with breast cancer. We were very fortunate that it was found early during her yearly mammogram. Routine preventative care, such as mammograms, is required to be covered by insurance as part of the ACA. So without the ACA, we most likely would not have known about mom's cancer until it was too late. My dad passed away in the summer of 2017. It was a traumatic time for my family. The total costs of his treatments from that year were enough that without insurance through the ACA or Obamacare, we would have had to sell the house and still file for bankruptcy. So I'll absolutely say that the ACA is not perfect, but it saved my mom's life and it saved my family from crushing medical debt. Currently, I work at Planned Parenthood of Wisconsin here in La Crosse as a public affairs organizer. Things like this budget reconciliation bill are part of my job. As you've heard, the bill proposes drastic cuts to Medicaid and the ACA/Obamacare. These proposed cuts would be catastrophic for the healthcare system as a whole. And as we've already heard from other people, I'm going to reiterate, even if the cuts to Medicaid don't directly affect you, they will indirectly affect you when hospitals close and people lose their jobs. The cost of healthcare will increase for everyone. People will be unable to access healthcare, and I'm not going to mince words, people are going to die, especially in rural areas. This budget reconciliation bill is hundreds of pages long, and we know by their own admission that not all of our representatives who voted in favor of the bill even read the whole thing. So there's a provision in this bill. It is Title IV, Energy and Commerce, Subtitle D, Health, Part 1, Medicaid, Subpart A, Reducing Fraud and Improving Enrollment Processes, Section 44126, Federal Payments to Prohibited Entities. You'll find the verbiage begins on page 351, line 17, and goes through page 354, line 7. I do have a couple copies with me. This provision is written simultaneously specific enough and vague enough that the point is to defund Planned Parenthood. Now, remembering that since the Hyde Act in 1977, Medicaid cannot, does not, and has not reimbursed for abortion care, except in very specific instances. So this is not about funding or not funding abortions. This provision would not allow Planned Parenthood to receive Medicaid reimbursements for any of our services, including birth control, STI testing and treatment, cancer screenings, gender-affirming care, pap smears, and wellness checks. In Wisconsin, that is over 50,000 patients that would not have access to this care with Planned Parenthood. And for reference, that is about the population of the city of La Crosse. Nationally, more than 1.1 million patients could lose access to care through Planned Parenthood. Cancers will go undetected, STIs will go untreated, and birth control will be harder to get. And that's just the numbers from defunding Planned Parenthood, let alone the entire healthcare system. So now back to the late 20-teens and me personally. During this time, since I was helping caregiving and I was just back from overseas, I was working multiple part-time jobs. I actually really loved all these jobs, but none of them offered benefits, and they all paid around $10 an hour. So I then qualified for Medicaid, or Badger Care, as we call it in Wisconsin. Badger Care allowed me to continue my yearly health exams like pap smears and mammograms, and when a pap result came back abnormally, I was able to access follow-up testing and get the treatment I needed. Without Badger Care or Medicaid, I would not have received that diagnosis until much later, when it would have been life-threatening. I've also dealt with mental health issues my whole life. And through Badger Care / Medicaid, I was able to see a doctor for the medications I needed at that time and find a therapist to help me process the family trauma that I had referenced earlier. So without Badger Care or Medicaid, I don't even know if I'd be alive today. Thank you.
Thank you, Amy. We're going to continue with our stories from the community and invite Rhonda and Ben to come and tell us their story about their family and their impact of Medicaid cuts if that would occur. Thank you for coming, Rhonda and Wynn.
Well, I'm Rhonda, and this is Ben. Ben is our friend who has lived with cerebral palsy for almost 50 years now. We are sharing his story to show how important Medicaid has been for him and helped him live as independently as possible. While Medicaid pays directly for certain things, once you qualify for it, it opens the door for other types of assistance. So let me ask you a few questions, Ben. It's obvious you came here tonight in a motorized chair that was obtained through Inclusa, which is a Medicaid-funded managed care organization. How important is your chair to you?
It's majorly important. My wheelchair is my legs and my car, basically.
Thank you, Ben. Oh, by the way, how did you get here tonight? Because you couldn't come this far in your car chair tonight in the rain. So how did you get here?
I took a handicap accessible taxi cab. They brought me here.
And that was also funded by Inclusa, I believe. So those are ways that he has been able to use that program. Now let's go on to something else. I know you bought your own mobile home 25 years ago and managed to live there with the assistance of aides who come 4 times a day. What services do they help you with?
My own health aides will get me up in the morning, get me ready, feed me my meals, give me a shower, shave, and then they come back and put me to bed at night. Without my age, there's no way I could be living on my own. Yeah, if they don't come, I don't eat. And I like to eat.
Speaking of eating, how do you get your groceries?
I go with one of my aides to the store via the cab. We go get everything. The cab waits for us and then takes it back to my house.
I know there's a program called in Wisconsin Food Share. It's also called SNAP, the Supplemental Nutrition Assistance Program. Is that something you can use?
Yes, I have that, and that helped a lot. Fortunately, it's been going down lately, so that kind of hurts. But yeah, that will buy my groceries mainly for 2 weeks out of the month.
As far as communication goes, I know you like to use your computer. That's been a real lifesaver for you, hasn't it?
Yep, I have my own computer, and I like me keep in contact with my family, friends, and basically give me something to do.
I know he's got 855 friends on Facebook, which is about 800 more than I do. So what helps you use your computer? You have some devices that help you.
I have a little bigger keyboard than normal, and I use a trackball mouse instead of the regular mouse.
And do you also have some kind of a speaker phone thing?
Yep, I'm unable to hold a phone, so all my phones in my house are speaker phones, so all I gotta do is hit the button and talk.
And one final item here. I know that last year you had some neck surgery and you needed to spend, I think, 4 months in a care facility for rehab. I know you appreciated the care you got, and you have lots of friends still that you made while you were there. And the staff all loved him. We'd go to visit and didn't even ask where his room was. Oh, Ben's over there. But in spite of how wonderful that was, how does it compare with living in your own home?
Oh God, no, I would so much rather be on my own. I've lived on my own since 95, and it would absolutely devastate me if I had to lose my independence.
Thank you, Ben. So in closing, these are some of the ways Medicaid and other related services are vital to Ben and to the survival of many people in Wisconsin and throughout the country. We're happy to show you how important it is to Ben. Thank you, Ben.
Thank you.
Thank you for listening.
Thank you, Ben, and thank you, Rhonda, for helping to share your story. Mary is going to share a story now, a little bit about the historical perspective of life in La Crosse before the current Medicaid-funded programs, just to give us a picture of what things have been like.
You know you're getting old when you provide the historical perspective on anything. So it's interesting that I have an extreme passion, unbelievable passion for community-based care and people being able to make their own decisions about what and where they want to live and who they want to live with and who they love. So I've worked the last, maybe probably 16 years here in La Crosse County and developed the ADRC, worked with Wanda, and long-term care. Eclusa is a extension of what we did here in La Crosse. We were one of the first pilot programs. And when I started developing the changes in the long-term care, community-based care, we had waiting lists that were hundreds of people's of names that were either disabled, elderly, developmentally disabled, and some of them died before we could get to them. Then we developed a program. Instead of getting we used to get just a pot of money, and we had to spread that around for all the community-based care. Then we developed a program where if you were eligible, then you got the home care services. You didn't have to be put on a waiting list. The 18-year-olds that graduated from high school got help. The crazy people that I've known got their wheelchairs and drove all over town and got into trouble. I think he did, but I'm not sure. No more? Okay. But anyhow, so that is where we were, and we developed all of these wonderful programs. We worked hand in hand with the vocational services and provided most of the funding, Inclusa does, and stuff. So that was, I think, a wonderful thing. And the message that I want to give tonight is, and I quote someone, we can't go back. We can't go back to when people are not eligible for the programs. I always figure there's two ways you can cut programs. You cut the eligibility and you cut the services that are provided. So at some point, they could say, we're no longer going to pay for eyeglasses. And that would cut a lot of Medicaid dollars, or hearing aids, or home care. And let me tell you, on the years, my many, many years of experience, that when people can remain in their homes, they're happier. And when people are happier, they are healthier. And when they're healthier, we save a heck of a lot of money. So I just, I can't say enough about how we have to stop them from cutting any kind of Medicaid services, because they've been hard-earned and they are very deserving. The people that get it deserve it. And we need to be a society where we take care of our elderly and our disabled and our physically and emotionally challenged people. So that's what I got to say. And now I'm part of the aging unit, so now I'm an old person, and I really like having good services for old people. And I got to tell you, we kind of really do have them here in La Crosse, so.
Thank you, Mary, for that perspective. We have time for one more question. We actually have someone who'd like to ask a question or to speak a little bit in person. Nicole, would you like to come up and just take a couple of minutes to advocate for your family story?
Like she said, my name's Nicole Bujanowski, and I have a son who benefits from the Medicaid program in a couple of different ways. Oh, sorry. I have to crouch down too. So my son is 11, and he qualifies for Medicaid as a supplemental secondary insurance for things that our primary insurance doesn't qualify for, but he also uses the Children's Long-Term Support Waiver that John talked about, and the different things that they help provide. So as a supplemental service of our insurance, it helps cover costs that our primary insurance does not cover. And so the cost onto us as his parents is a lot less. Without having to pay all those extra medical fees, we have the money to give our son other opportunities in life that we otherwise would not be able to. The other thing is, with the waiver program, it has provided him with numerous amounts of things. As he's getting older, we are definitely using the program a lot more for the different various services that he needs. I would say when he was around 4 is when we really started to need the services. And that's involving with the incontinence supplies that they help us with, the respite care that he gets. So as a parent with a very complex, medically complex child, you can't just hire the 14-year-old babysitter off the street. You need somebody who is knowledgeable and knows how to manage a wheelchair and a non-speaking individual. And so through the respite program, it's allowed us as a family to afford more opportunities. We've taken respite providers with us on vacation so that we have opportunities to explore more areas that we wouldn't otherwise have been able to do, and give our daughter, who is typically developing, more opportunities that we as a family wouldn't with a complex child. The other thing they have provided us with is home modification. So my son uses an ambulatory gait aid, and he wasn't able to propel his walker without laminate flooring. So they helped us get a ramp as well as laminate flooring and removing of our carpet and tile so that he's able to access our entire home. And we love the outdoors. We love being outside, but a wheelchair is not feasible everywhere, right? And insurance will only pay for a wheelchair or a stroller. They won't pay for both, and they will not pay for a backpack carrier for you to be able to carry your 11-year-old son up a Rocky Mountain National Park, which we were able to do last month because of the support from this program. So without those kind of things, our son socially would really be limited, and that would be really hard as parents as well on for him. So there's some great services that Medicaid affords these families, and I am fortunate enough to be able to receive some of those. So,
thank you for sharing your story. We are beyond our time to take more questions, but one of the questions actually refers to how we can make things work for us, which is a perfect segue to go back to what Leslie was talking about in terms of learning about advocacy and what we can do in terms of actions. So I'm going to turn things back over to Leslie. Thank you to all of our speakers for sharing your stories and to our panelists for answering questions. Leslie.
Thanks, Catherine. Thank you, everybody. Let's talk a little bit about advocacy, because that's one of the things we wanted to take away tonight. The taglines you see on virtually any communication that's by or from the League of Women Voters include these words: empower voters, defend democracy. And here's what that means to us. We envision a democracy where every person has the desire, the right, the knowledge, and the confidence to participate. Tonight, we especially want to focus on two takeaways: knowledge and confidence. We hope you learned a lot in this past hour. We hope you go to our website to revisit the recording, explore some of the additional resources we'll be posting there, and share the link to this program with those you know are interested in this topic. As for confidence, after everything we've heard tonight, it sometimes feels hard to come by, and not to mention the scope of everything happening in the world right now. But we have to believe that there is always something that we can do. So on your seat and at the lobby table, you will find a small bookmark size piece that has some suggestions we hope you'll find helpful. Ideas that encompass ways to learn, ways to connect, and ways to engage. We've all heard the saying, democracy is not a spectator sport. It means that a healthy democracy requires engagement, involvement, and taking initiative from we the people, not just people in positions of power. It means being a participant, not an observer. So please take this with you as a reminder, take some for your friends, learn, connect, engage. And in closing, I just want to share with you a call to action that League members throughout the country received from our National Government Affairs Director. With just weeks left in this budget process, we need your help urging Congress to oppose Medicaid cuts. The Senate is working to negotiate and pass its version of the bill. Then the House and Senate will resolve the differences and vote on a final bill before sending it to the president. Now is the time to reach out to your senators and keep the pressure up in the House. We need as many voices as possible demanding that Congress reject legislation with Medicaid cuts. Please take 1 minute to send a message to your members of Congress. Tell them to protect Medicaid. The health of our nation depends on it. So I'm just going to, I know we're at our time, but I just thought I'd ask our panelists, is there anything that you would like to add for us to send us on our way tonight? If there's anything you would like us to act on? Yeah, great.
I just think simply sharing your voice. Continue to share your stories. It's important. It's critical. We hosted an in-district meeting a few weeks ago, and I know the legislators are so appreciative to hear those stories that when they are talking to their peers, they can share those stories, right? It's impactful. It makes a difference. You might think it's minimal. It's not. Something as simple that you might think is simple is big, and it's important. And so I would just say continue to share your voices. It's critical. Even tonight, I just want to thank each and every one of you for sharing your personal stories. It matters. And those are the things that we'll think about, and we'll continue to share ourselves through this advocacy. So please continue to be the voice for others who perhaps can't, and share those stories. It's critical. Thank you.
Thank you. And so on the slide up here, we are showing you again where you will find the recording and resources relating to tonight's program. Well, I think we had some handouts, we've got slides, we've got other information, so you'll be able to find it on our website. Panelists, it's been amazing what you've helped quantify what's at stake. Storytellers, you've put a human face and voice to what Medicaid means to you. Thank you all for being here. We have a round of applause for our... So I promise we're wrapping up now. I just wanted to say thank you to our hosts at UWL who have been terrific, our technical support from Jim Jorstad and Rob Ramzier, and I really want to thank our co-sponsors again for helping to promote this event with their stakeholders and others in the La Crosse community. On behalf of all of us, just want to say thank you and good night, and get home safely in the weather.